Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona, and today I want to talk about a condition called piriformis syndrome. And I'm going to talk about what it basically is. We're going to talk about different ways it can be treated, and we're going to give you a couple of easy exercises that you can start on with it. Piriformis syndrome can be a complex issue, so it does require someone with knowledge of it to make sure that you're getting the proper treatment. So the first place that we're going to look at here is just on Wikipedia, right? So it gives you a description of it, and it talks about the sciatic nerve and how it can get irritated. Well, I'm just going to put this into terms that are easy to understand. I'm actually going to pull up a different picture here. So the sciatic nerve is a big bundle of nerves that passes kind of right through your rear end here. So this would be like your hip. It's actually called your ilium. This would be your femur right here. You've got this band of muscle tissue called a piriformis muscle, and it stretches from your sacrum or part of your pelvis, and it goes out here and attaches into your hip. Well, there's two different things that can happen with piriformis syndrome. In a small percentage of the population, the nerve actually will pierce and go through that muscle. So then, if this muscle becomes overactive, it actually will strangle or irritate this nerve coming out, and you'll get pain going down your leg, really bad pain throughout your hip in here, and it's not a comfortable feeling. So that's a small percentage. For most people, the nerve travels underneath the muscle, but regardless, same things can kind of irritate it. So if that muscle gets overactive or irritated, that can cause that nerve to flare up. Now, it talks on here that some of the ways to determine it are going to be with a type of MRI. Well, that's all well and good, and if you want to really get some answers to your problem, that is a good thing that you can try. Now, one of the things you can also do is a an ultrasound on the area. We do diagnostic ultrasound that actually will give you a little bit of an idea as well. So, once again, with anything, determining the correct diagnosis is key. Now, there are certain things that can um, cause and irritate the area, and what I have found is that a lot of times sitting too long can irritate it. If you sit too long and this muscle and the joint through here called your sacroiliac joint isn't as mobile as it should be, then the muscles in the front of the thigh, so you can't see them on here, but on the other side of here, the muscles that run on the front of the leg, this is the back right here, they will get overactive. And if the muscle in the front of the leg is overactive, this back here becomes underactive. So then it's almost like a rubber band effect. The front's too tight, it pulls on here, causes immobility here, and causes this to get massively inflamed. And I find that to be probably one of the more common reasons why people get this condition. So our clinic, there's a whole lot of stuff here. If you really want to get into it, I encourage you to go there. I'm not going to get into that and bore you. We're going to go right to treatment. There's different things that can be done. You can do things like non-steroidal anti-inflammatory drugs or NSAIDs or muscle relaxants. Muscle relaxants will calm this muscle down. An NSAID will decrease the inflammation in there. Things like stretching, myofascial release will be like a type of massage here that can help alleviate a lot of that as well. Avoiding things like running, bicycling, rowing, etc. can be helpful. Physical therapy is super helpful. There's a couple different exercises that we're going to show right now that we have found to be beneficial. So the first one that we are going to get into is the resisted hip flexion straight leg standing with an elastic band. So what you're doing essentially is you're tying a elastic band right to the ankle, and that will be tied into like a wall or into a door, and you're essentially going to kick your leg out. All right. So you're going to do that nice and slow. You're going to do about 2 sets of 10, do it once every other day. You can up the intensity or the strength of the band as they get easier for you to do. Okay, another one that you can do is a resisted hip abduction with one leg while standing. Abduction means you're taking the leg away from the body. So with this person right here, what you're going to see is that they're standing, they have a band once again tied into the wall opposite of the leg, and you're going to bend the leg out. Okay, so you're going to just kind of do a sweeping motion. You can do about 2 sets of 10 as well. So if the therapies and all that doesn't work, if icing and all those things don't work, massage, one of the most beneficial things that we've ever seen in the clinic here is if the sacroiliac joint is involved, this joint right here, you can do like an ultrasound guided injection in that area. That will get you super quick relief. And then once the inflammation swelling isn't as bad in this area, we can get to the therapy quicker. It makes no sense to do stretching and exercises if there's massive inflammation here and the pain is so intense. So if you can get that under control and then work on the muscle after that, it makes much more sense. We do that in our clinic. I actually personally just went through this like a week ago. It's very painful. I don't wish it upon anybody. So if you are having issues with your piriformis muscle, your low back, or your hips, or you just aren't really sure what's going on, we do offer a free consultation in the clinic. So I'm going to actually have a video demonstration of the exercises that we just put on, but at the end there's a link to our website where you can get your free consultation coupon. At that point, we'll do an analysis and see what we need to do with you next. So thanks for watching.